Hello everyone, let's try to solve this question together. So here we have a 35-week preterm infant and she's noted to have the following labs which are displayed on the right side of the screen. She's on 20 calorie formula feeds and has no IV. The physical examination is normal. So based on the labs and the history given, what is the best management here plan? Pause the slide, zoom the picture. Okay, the correct response here is this: follow clinically. So now let's see why the other options are not the correct choices. Change the formula to low phosphate. See here, the phos is high and calcium is low, so that's for sure. But because this baby is late preterm and this is just after birth, baby is not even 24-hour old, and sometimes the PTH takes its time to kick in. We should give that time to the baby and not jump directly to changing the formula. So that's why this is not the right choice. But of course, if the high phosphate is persistent, then we can consider changing to a special formula which has low phosphate. What about giving IV calcium over 30 minutes? As you guys can see that the calcium is low, that is agreeable, and also if you look in the blood gas, the ionized calcium is low. But the good part is that the physical examination is normal. If this baby was symptomatic, then of course this choice is the correct choice. If baby is having, tremors or signs of tetany or something like hypocalcemia sign, then we should consider that. But in the given case, this is not the right choice. What about giving PO calcium? Again, for the same token, that give this patient some time to recover, because patient is not even 24 hours old. Let the PTH kick in and then will follow. And try to remember, if you just recall that, look at this corrected, calcium is not that bad. Even for this albumin of 2.9 and 6.8 of calcium, your correction is not that bad for the first 24 hours we can follow. So anyway, in conclusion, whenever you are dealing with hypocalcemia in first 24 hours, a lot of decision depends upon if the patient is symptomatic or not. Asymptomatic hypocalcemia could be monitored, and but don't delay the labs more than 24 hours and act accordingly. Jumping on giving IV or PO calcium is not the right choice. Give some time for the baby to recoup from that. I hope you guys have learned something together today. You guys have a wonderful day. Bye.